Magandang umaga po sa ating lahat. Yan, Special Professional Licensure Examination 2019 or Nursing Licensure Examination. Welcome po sa ating lahat and I'm hoping marami po tayong natutunan last week. Yeah, sorry, we're trying to test the system and right now, medyo nakahanap ako ng magandang anggulo para mas malinaw po natin na ma-record lahat po ng ating mga lecture. So, pagdating po sa inyong mga mobile phones, mas madali at saka mas clear yung sound. Okay? So, but before we start our lecture, let me just give you this tips kung paano tayo makakapasa sa board exam. Okay? So, number 1, nakalagay dito, nabasa ko lang to sa prcboard.com. Yan. So, number 1, ang kailangan nyo daw gawin para tayo ay pumasa ng board exam is mind setting. Okay. The moment na nag-attend kayo ng orientation or the moment na inisip ninyo na I'm willing to take the chance, regardless kung bumagsak ako or konti na lang yung difference nung score for the passing, kailangan ma-mindset ko na that I will pass the examination. So, ito yung ating ipinoprovide ngayon. Dapat may mind setting na tayo ang magiging susunod na professional nurse na aakyat next year. So, i-mindset na po natin yan. Pangalawa, self-discipline. So, of course, importante ang disiplina. So, hindi ako nagagalit kapag meron akong sinasabihan na kailangan idisiplina nyo yung sarili nyo pagdating doon sa pagre-review. Okay? So, if I said that I'm giving you for 1 week to access the examination and at the same time, dun sa lecture, dapat i-follow po natin yan. Kasi, habang dinedelay nyo ng dinedelay yan, magpapatong-patong yung lahat ng ating mga information at baka po kayo mas lalong maguluhan. Always remember na kayo po ay hindi kapapasala lamang. Okay? Hindi pasintabi po. Hindi po ako nagbibigay ng ibang insinuation. But alam po natin na yung majority po sa atin ilang beses na pong bumagsak at ilang beses na rin pong na nabigo. Okay? At yung iba naman, masyado na pong mahaba yung day ng graduation or not the day but the year of graduation until today. So sobrang haba po ng hahabulin natin. Kaya importante po ang disiplina. So hindi naman ho ito para sa amin. Okay? So kapag kinukot ko yung attention ninyo, huwag nyo pong iisipin na kayo po ay pinapagalitan, kundi pinapaalalahanan lamang. Pangatlo is kailangan po nating maging resourceful or maging resourcefulness. Yan. So, if you have a tight budget and you cannot afford to send yourself sa review, ito na po yung atin pong ibinibigay na pamamaraan para po mas maabot po natin kayo. And dito po napupunta yung binabayad ninyo. Is we need to invest in this type of technology para kahit po nasaan kayo, kagaya ho nung sinasabi nung iba, Kahit na sila ay break time, kahit na sila ay nasa sasakyan, nakakapag-review sila. And the beauty about this access, it's because we're going to screen everything na ilalagay namin dyan. Hindi tayo basta-basta maglalagay ng content na sa tingin natin ay hindi ninyo papakinabangan. So, bear in mind na pinag-iisipan po natin lahat ng ating ilalagay dyan. At makakasigurado tayo na ito ay tama at ang pinaka-importante sa lahat ay local board ang approach. Okay? Pang-apat, prepare. Ayan. So, preparing for a licensure examination is tough. So, in order for you to succeed, you need to be prepared not only by reviewing, but by taking care of yourself holistically. Yan, syempre, paano tayo makakapag-absorb ng maraming information kung kayo po ay gutom, kung kayo po ay walang tulog. So, obviously, kailangan po natin na magpahinga. Kapag relax na yung isip natin, that's the proper time for you to study. Okay? And syempre, kasama dun sa preparation, dapat i-identify natin kung saang system tayo magsisimula at kung ano yung weaknesses natin, doon tayo magsimula bago dun sa strength. Kasi sa strength, wala na tayong problema doon or konti na lang ang iba-brush up ninyo. Pero dun sa weakness ninyo, say for example, hindi nyo maintindihan yung about the acid-base balance. Hindi nyo maintindihan kung paano kinukuha ang ABG. Hindi nyo maintindihan kung paano nagkakaroon ng assessment. Anong components ng ganitong klaseng assessment. So, dapat doon tayo papasok at magsisimula na aralin ulit. Okay? Walang masama kung tayo ay paulit-ulit. You need that to happen. Okay? Para makuha natin ang lisensya. And of course, mag-review ng mag-review. Yeah. Don't end the day without reading some of your notes. Isa sa pinaka lagi kong pinanghahawakan at lagi kong ini-impart sa aking mga estudyante, and alam ito nung mga last na batch, hindi ako basta-basta nagbibigay ng notes. Okay? Siyempre, may copyright issue kasi. So, it's either may sarili akong content at meron din yung pinagkuhanan ko or kinuha ko lang siya sa labas. And ayoko naman na sabihin nila doon ay ginagawa natin na hindi tayo nagbibigay ng input or ng proper accolades or ano ba ang tawag natin doon, proper note na galing ito sa kanila. Okay? But the information is actually everywhere. So, walang nagmamay-ari nun unless there is a book. But, again, mas maganda para sa inyo na lahat ng sasabihin namin sa lecture, bawat slides na gagamitin namin, you have to write it down. And it's very effective. Tapos, saka nyo siya ita-transfer sa inyong laptop. At doon natin ngayon babasahin yung pinaka sinasabi dito na notes na meron kayong sari-sarili. Mas mataas yung retention kasi ito yung magiging weapon ninyo. Okay? Remember, napakadami yung aaralin. Okay? Next is confidence. Yan. So kahit na pinanghihinaan na tayo ng loob, kahit na hindi na tayo nakaka-review talaga dahil sobrang busy natin sa trabaho, hindi naman kawalan kung mananalangin tayo at magdadasal na igabay tayo. Manghingi kayo ng strength. Ayan, naandyan ang St. Mary's Church, napakalapit sa atin. Or kung nasa Abu Dhabi kayo, you just go there and talk to him. Kausapin. Not necessarily na pupunta lang kayo ng simbahan just for that. So, depende sa kung-anong diskarte ninyo. And importante syempre yung relationship ninyo kay God. Regardless kung kayo po ay nasa harapan niya or nasa simbahan or sa inyong mga tahanan. Or kung kayo naman po ay Muslim, call Allah and try to get some wisdom from Him as well. Next is humbleness. So, how to attain success? Of course, you need to pray to God, never pull other people down, and never think that life is a competition. Help, coordinate, and cooperate. At medyo tumitingin po ako sa taas, no? Meron po akong isa pang laptop dito. And put your feet on the ground. Remember where you came from. Give yourself a break. Remember that there are a lot of people behind you cheering for you. Believe that with God, nothing is impossible, and never give up. Tatandaan po natin yan, na lagi po nating ilalagay ang ating mga paa sa atin pong inaapakan. At wag ho tayong magyayabang. Hindi ko komot kayo po ay mas nakakaangat sa buhay, ay ibig sabihin mas mataas yung chances ninyo na makapasa. Nakapag-review center kayo, ay mas makakapasa. Hindi po sa ganon. So, ang ano lang po natin dyan is magpakumbaba. Okay? So, yun po ang ating key para dyan. And, lastly, little bit of everything. Okay? So, anong ibig sabihin nun? Not everything you studied in review centers come out in the actual board exam. And that is why it is important that you have idea of everything. Always go back to your foundations because the questions are purely basic but too hard to comprehend. Alam mo, napakaganda nito. And isa sa mga tool ko kung paano ako nakapasa, it's because I always go back doon sa mga tinuturo, and I was happy and at least siguro blessed dahil nung nag-aaral ako, majority ng lumabas sa board exam ay halos tinuro lahat ng aking professors. So, napakagandang foundation nun. So, well, lalo na dun sa mga iba na sobrang tagal na ng kanilang graduation day, medyo mahirap nang mag-recall dahil ang dami nyo ng pinagdaanan. But right now, we will try our best. Hindi lang po ako, okay? Ako lang yung masyadong visible na nakikita ninyo dahil meron akong time sa gabi at wala ang family ko dito. That's why. But sila Sir Pau, sila Sir Ronald, si Ma'am Quincel from Alain, at the rest of our lecturer ay willing na magbigay sa inyo ng lahat ng knowledge na pwede nilang ma-impart in order for you to pass the board exam. And syempre, ang pinakahuli, lagi tayong magdadasal. Okay? So, lahat naman ito ay syempre hindi magiging posible kung hindi natin hihilingin sa Kanya. Okay? Again, sabi ko nga kanina, kailangan magkaroon tayo ng personal relationship sa Kanya para masabi po natin na ano yung kailangan, mag-bargain tayo sa Kanya, ano yung nais nyong isakripisyo. Ayan. So, ganyan ang ginagawa ko . Pag meron ako isang bagay na ginagawa or hinihiling sa Kanya, lagi kong sinasabi na ito yung aking possible na hingiin at ito yung aking possible na i-bargain. But that's me. Okay? That's me. So, yun sa inyo po, bahala na po kayo kung paano nyo siya ipi-please, kung paano nyo siya hihingiin. So, I will leave everything to you. Okay, so now, moving on. Special Professional Licensure Examination or Nursing Licensure Examination. This is in partnership with FNAE or Filipino Nurses Association in Emirates. Huwag po tayong magkakamali. And PNA, Dubai, and Northern Emirates. Okay, so dalawa po ang presidente natin dyan. Ang FNAE, si Sir Joel Hualde. At dun sa PNA, Dubai, and Northern Emirates is si Teresa, ano na nga bang last name ni Ma'am Tere? Okay, so pasensya na po, medyo tumatanda na. Laresa, ayan, so si Ma'am Teresa Laresa. Okay, so moving on. So, today's speaker, obviously, I am here in front of you sa mga TV screen ninyo at sa inyong mga mobile phone at sa laptop, obviously. And I'm a registered nurse, registered nurse in the Philippines and also in the UAE. Ayan. So I have Masters of Science in Nursing in 2017 from St. Jude College, Manila. Meron akong IIWCC, that's why meron akong title ng Wound Care Educator and Wound Specialist. I got this from University of Toronto in Dalai Lama Public Health. Yan. STI and HIV/AIDS trainer ako from 1999. Okay, until today, nagbibigay pa rin ako ng mga consultant work and training materials para sa mga iba't ibang organization. Yan. Strategic Health Education Professor, I was, yan, and clinical instructor in my school before in PCHS. Hospice and Palliative Care Nurse Resource. Home Health Consultant ako ngayon dito sa UAE. And I have 10 years of experience in nursing. Okay, so obviously hindi yun ang ating pag-uusapan ngayon. Ang pag-uusapan po natin ngayon ay yung agenda ng second part ng ating community health. So obviously, ide-define natin yung vision, yung mission, and objectives ng mga programa ng Department of Health, which is ito yung nasa Unit 4. Okay, so yung Unit 1, 2, 3, binigay na po yun ni Sir Ronald. So, ito yung Unit 4. So, program components, partner institution, policies, and laws. Medyo boring yung ating magiging approach ngayon dahil everything is all about text. Okay? So, just to give you a heads up. At lahat po yan, obviously, ay babasahin po natin. Wala po tayong way para kaligtaan dahil ito po ang healthcare system ng Pilipinas. Okay, one of the program na ibinibigay ng Department of Health ay yung Safe Motherhood Program. So the mother and child are the most delicate members of the community. So the protections of the mother and child to illness and other risks would ensure good health for the community. The goal of family planning includes spacing of children and responsible parenthood. Ang setting natin sa Pilipinas, for obvious reason, napapansin natin, 'di ba, na meron tayong mga hati-hating community. And isa ito sa mga nagpapahirap sa pagbibigay ng programa ng Department of Health dahil sa ang hirap abutin yung mga community na yon. And at the same time, hindi rin ganoon kadali na pumasok sa area. Okay? During our time, nung ako ay nagbibigay pa ng HIV/AIDS education, hindi kami makapasok doon sa area ng Caloocan dahil merong mga gang doon sa area. And meron kaming kukuhanin na buntis na HIV/AIDS positive at dadalhin namin siya sa Fabelia para magpa-check up. Pero obviously, kailangan namin mag-intay ng napakatagal na oras para lang ma-guide kami papasok doon sa community na yon. And bukod doon sa story na sinasabi ko, kahit naman siguro doon sa balita, yan, marami tayong naririnig na parating merong namamatayan or sa community, definitely, na namamatay dahil sa hindi maayos na serbisyo or hindi na-access yung serbisyo ng gobyerno. And isa rin sa mga napapansin ko kapag nung nag-duty pa ako sa community, hindi sila nagpapa-check up ng maaga. So usually, ang check-up nila is pag manganganak na. So yung mga importanteng vaccine, yung mga importante na mga prenatal check-ups, at saka laboratory examination na libre naman nilang nakukuha ay hindi na natin na ibibigay. So hahabulin natin yon. But obviously, hindi natin mahahabol dahil kung ano lang yung state of mind at kung ano lang yung state of health and kung ano yung pwede nating ibigay on that moment, yun lang yung ating serbisyong ito-document. So ang philosophy ng programang ito ay pregnancy, labor, and delivery and puerperium are part of the continuum of a total life cycle from personal, cultural, and religious attitudes and belief influence in the meaning of pregnancy for individuals and make each experience unique. MCN is family centered. The father is as important as the mother. Okay? So self-explanatory na po 'yan, ha? So ano yung goal ng programa? To ensure that the expectant mother and nursing mother maintain good health, learn the art of childcare, has a normal delivery, and bear healthy children. 10 years ago, kung mapapansin natin, yung mga nanay, lagi silang nagsisiksikan sa Fabella if they are from Manila. At napakahirap dahil kapag nagjo-duty kami doon nyo makikita yung worst case scenario ng isang pediatric and at the same time ng mother going to deliver. As in, sobrang daming bata, sobrang daming nanay. So, I think the government is somehow we have to commend dahil na-downstream or na ibaba niya yung serbisyo because of PhilHealth. Kaya yung mga midwife, meron na silang mga sarili-sarili nila na birthing center. Yan. So, ang problema nga lang, dapat yun kasali ang mga nurses, kaya marami pang mga technicalities, kaya hindi pa siya na o-organize ng mabuti. Okay, next. That every child lives and grows up in a family unit with love and security, in healthy surroundings, receives adequate nourishment, health supervision, and efficient and medical attention, and it's taught the elements of healthy living. Yan. So, importante syempre na habang lumalaki yung ating mga anak at syempre yung pamilya ang kailangan maging sentro ng love and security and healthy surroundings para mas maging maayos yung paglaki ni baby. And obviously, yung ating, puro ko obviously, no? Ang dami ko ng most abused word right now. So, nare-receive natin adequate nourishment. Hindi naman kaila sa atin na yung presyo ng bilihin ay tumataas at kaya napapabayaan. Ang magiging role natin or ninyo bilang mga future nurses ay kailangan ninyong turuan at gabayan ang ating mga pasyente na kahit ganito lang yung budget nila, pwede pa rin maging nutrition based yung approach ng pagkain ng mga bata. Yan. So marami tayong mga pagkain na pwedeng maging source of nourishment. Kaya lang tamad na rin kasi ang tao, 'di ba? So mas okay na yung noodles, okay na yung chichirya, okay na yung tinapay kay Aling Maring, okay na yung bumili na lang ng sabaw. Yan. Pero hindi nila naiisip na in the long run, mas magiging malaki yung problema kapag hindi nagsikap si nanay or si tatay na kahit nasabihin natin na mahal ang bilihin, handa pa rin sila ng ulam na pasok sa budget pero maayos yung nutrition ng mga bata. So, ano bang ibig kong sabihin? Dati sa probinsya, libre na yung mga talbos ng kamote, ano pa bang mga dahon-dahon natin dyan, alokbate, yan yung napakahirap kainin na kulay violet. Yan. So sa mga Ilocano, I am so proud of you dahil majority sa kanila nakakain yon with bagoong. But hindi ko kaya. Ang kaya ko lang ay yung talbos ng kamote, tapos ano pa? Yung katuray. Yan. Hindi ko alam kung anong tawag sa kanya hindi ko alam kung anong tawag ninyo sa probinsya ninyo kung ano yung katuray, but yung bulaklak niya nakakain yon. And alternative yun para sa I think this is rich in, if I'm not mistaken, let me just see. Katuray. Okay. Let me just get that. Okay, medyo matatagalan tayo dyan. So, i-search ko na lang yan. So, health supervision and efficient medical attention, and it's taught the elements of healthy living. So, importante na mapaintindi natin yan in the community level, yung atin pong approach. Yan. So, classification of pregnant women. So, meron tayong tatlong qualification. Number 1, normal or healthy pregnancy. Pangalawa, with mild complication. So, kailangan magkaroon tayo dyan ng frequent home visits. Pangatlo, with serious or potentially serious condition referred to the most skilled source of medical and hospital care. Okay? So, importante na kapag nasa ganitong sitwasyon ang ating pasyente, kailangan naka-ready yung referral area. At the same time, yung kanilang pupuntahan ay merong kontrata directly from that institution or sa mga regional or sa mas malalaking ospital para kapag nagkaroon ng problema, madadala natin kaagad si nanay. Okay? So, home-based mother's record or HBMR. So, ano to? Ito yung tools na ginagamit natin when rendering prenatal care containing the risk factors and danger signs. So, lahat ng nanay na prenatal sa health center, ito ang dapat na meron sila. Yan, kagaya nga nung binanggit ko sa inyo kanina, pumupunta si nanay doon pero ang napapansin natin, for obvious reason, minsan 6 na buwan na or 7, 8, or mismong manganganak na bago sila magpapa-check up. So, gagawan pa lang natin sila ng record. Yan. So, may mga ganyan talaga, matitigas yung ulo. And, iba dyan sa community na yan, napakahirap pa. So, minsan, alam mo kaagad na hindi maganda yung pagbubuntis dahil sobrang payat ni nanay. Okay? So, ano ang mga risk factors na kailangan nating i-identify or ano-ano yung mga risk factors na mailalagay natin dito para masabi natin na si nanay ay delikado ang pagbubuntis. 145 cm yung tangkad or 4 feet and 9 inches. Kung below 18 years old or above 35 years old. From my experience, meron kami 12 years old na nanganak. Okay? Nabuntis. Sorry. Tapos nanganak siya ng 13 years old. Yan. So, client namin ito during my days in HIV/AIDS world. Yan. So, when we're doing the research for prostituted women, yun yung mga tawag sa kanila a long time ago. So, we had that 12 and 13 siya ng anak. Yan. So, very high risk. So, have had 4 pregnancies, okay, with TB, goiter, heart disease, diabetes mellitus, bronchial asthma, severe anemia. Last baby born was less than 2 years ago. Previous cesarean section delivery, history of 2 or more abortions, difficult delivery, given birth to twins, 2 or more babies born before EDD, and stillbirth. Okay? And weight less than 45 kg or more than 80 kg. So, ito yung mga risk factors na kailangan po nating tandaan. Okay? Kopyahin po natin yan at make sure po ilalagay po natin doon sa ating mga index card yung label na to para mas madali po nating matandaan. Okay. Another danger signs. Any type of vaginal bleeding, headache, dizziness, blurred vision. So, pag merong ang pasyente ng headache, dizziness, blurred vision, there is a possibility of eclampsia. So, kailangan ito dalhin agad sa ospital. Flappiness of face and hands, same thing, and pallor. So, oxygenation naman ang ating problema. So, kailangan dalhin to kaagad sa ospital once na ma-identify. So, prenatal care. Ano yung ating magiging identifiable? Pag tinanong tayo sa board exam, paano ba yung schedule of visits? So, ito yung breakdown. Schedule of visits. First, as early as the pregnancy. From the first trimester, kailangan si nanay magpapacheck up na. Dapat meron na tayong record sa kanya at dapat malaman na natin na ano yung detalye ng pagbubuntis, anong pangalan, lahat ng record dapat na-identify na natin. Ang second natin na visits ay yung ating second trimester. Okay? At ang third and subsequent visits ay nasa third trimester. At kung dadalasan na natin yung ating visit, so more frequent visits for those at risk with complication. Okay? So kung meron tayong pwedeng mautusan or kakutsaba or well, sa panahon ngayon pwede nyo nang tawagan. So what we're doing before, talagang nag-identify kami ng pwedeng magbantay, not necessarily physically, pero at least may matatawagan tayo para ma-remind lang at kung ano na nangyayari dito sa ating pasyente. At madala just in case na magkaroon ng problema. Okay, so kapag ang nanay natin ay pumunta sa center, importante na mabigyan natin yan ng tetanus toxoid immunization. Okay? So, meron tayo ditong nakikita sa ating screen, yung vaccine, yung minimum age of interval, percent protection, at duration of protection. So, okay? So, once na dumating sila sa atin, bibigyan natin siya ng TT1. Okay? As early as possible during pregnancy. 80% nito ang magiging proteksyon. Yung duration, obviously, wala pa. So, pag susunod na ang nanay ay babalik, magbibigay tayo ng TT2. So, at least 4 na linggo pagkatapos ng unang injection. Protection natin dyan, 80%. Okay? So, basahin natin dito. Infants born to the mother will be protected from neonatal tetanus, gives 3 years of protection from the mother from tetanus. So, 3 taon. So, pag tinanong sa board exam, naka-receive ang nanay ng prenatal check-up at ininjectionan ng TT2. Okay? Alam natin na 4 weeks yon at least later pagkatapos ng unang injection. May 80% ilang taon mapuproteksyonan si bata sa neonatal tetanus. Okay? At ganun din ang nanay. Ang sagot natin dyan ay 3 taon. Next, TT3. So, at least 6 months later. Okay? 90%. So, habang nag-a-advance yung ating date o yung ating injection, mas nagiging maganda ang level of protection. So, now, this is 90%. So, in terms of the details, infants born to the mother will be protected from neonatal tetanus at least 5 years. Protection for the mother. Okay? So, mas matagal. So, TT4. at least 1 year later. Okay? So, 99%. Okay? 99% ang magiging proteksyon nito kay nanay. Okay? So, gives 10th year of protection doon sa nanay. Okay? Ang susunod ay TT5, at least 1 year later. Okay? So, 99% gives lifetime protection for the mother. All infants born to that mother will be protected as well. Okay, that's good, di ba? So, anong dose ang ibibigay natin? So, 0.5 ml ng tetanus toxoid ang ibibigay natin sa nanay. Anong route? Intramuscularly. Anong site? Right or left? Or pwede rin sa deltoid or sa buttocks. Okay. So, para doon sa iba, and to refresh your memories, tetanus toxoid is used to prevent tetanus, or also known as lockjaw. Yan. And, sorry, nabanggit ko yata kanina sepsis. No, that's not the one. Tetanus is a serious illness that causes convulsions, or seizure, kung tawagin natin, and severe muscle spasms that can be strong enough to cause bone fractures of the spine. Tetanus causes death in 30 to 40% of the cases. Paano ba nagkakaroon ng tetanus? So, kung mapapansin natin, kapag ka nandun tayo sa labas, tapos na puncture tayo ng pako, hindi natin alam kung merong kalawang yung nakapuncture sa atin. So, yon ang main na magiging protection ng nanay at the same time ni bata. Ayan. So, marami din ako naging pasyente noon sa San Lazaro Hospital na nagkaroon nito. Ayan. So, sa awa naman ng Diyos, buhay naman sila. So, immunization against tetanus is recommended for all infants 6 to 8 weeks of age and older. Lahat ng bata and also ng adult. Pero kung hindi na nila naaalala yan, immunization against tetanus consists first of the series of either 3 or 4 injections, depending on which type of tetanus toxoid you receive. Yan. It is very important that you get the booster injection every 10 years. Okay? So, inuulit natin yan kada 10 taon. Okay? Also, you need to get a wound agad-agad, lilinisan yung ating mga sugat para maiwasan natin dyan. Okay, next. So, components of prenatal visits. Kapag ka nagpa-check up si nanay, kailangan nating malaman ang history, obviously. Kailangan nating makuha lahat. Determination ng obstetrical score, GP, TPAL, AOG, and EDD. Okay. Urine analysis for proteinuria, glycosuria, and infection. Kailangan natin ng dental examination, yung ating weight, yung height, at yung BP. Exam for conjunctiva and palms for pallor. Abdominal examination for fundic height, Leopold's maneuver, and fetal heart tone. Okay? So, importante yan, FHT. So, lahat itong component natin na to ay kailangan makuha at maging part ng prenatal visits. Okay? So, alin pa? Exam of breast, face, hands, and feet for edema, and neck for thyroid enlargement. Health teaching natin pagdating sa nutrisyon, personal hygiene, common complaints. Okay? So, bakit nilalagay natin ang nutrisyon? Tandaan po natin na kapag buntis si nanay, dalawa yung kumakain. So, kung hindi maayos ang pagkain ni nanay, hindi rin magiging maayos yung pagbubuntis at syempre, yung magiging nourishment ng bata. Personal hygiene, kailangan syempre magkaroon tayo ng perineal care dahil normal na nagkakaroon ang ating mga nanay ng mga yeast infection, specifically kapag sila ay kain ng kain or kapag hindi na monitor ang kanilang sugar. Okay, and also for hormonal reason as well. So, kailangan ito ay siguraduhin na maibigay ng maayos yung information sa ating mga nanay para maagapan kaagad kung magkakaroon ng problema. And then, yung mga common complaints, baka naman yung mga common complaints na ibibigay sa atin ay mga normal na nangyayari sa isang nagbubuntis para at least mabigyan natin sila ng tamang health teaching. Siyempre, yung tetanus toxoid immunization, importante, which is napag-usapan natin kanina. Iron supplementation, magsisimula from 5th month of pregnancy and tuloy-tuloy hanggang 2 months ng postpartum. Goiter, endemic area, so kailangan ng iodized capsule once a year. I'm not sure about this goiter endemic areas. So, I will try to research that. Okay, pero I don't think itatanong ito ng board exam. So, in malaria-infested area, prophylactic chloroquine, 150 mg per tablet, 2 tabs per week for the whole duration of pregnancy. So, prophylactic lang po itong ibinibigay. Malarial area, ito ay endemic sa Palawan. Yan. So, sa ibang area na malapit sa... So, under 5 clinic, the first 5 years of life form the foundations of the child physical and mental health and development. Studies have shown the mortality and morbidity are high among this age group. The Department of Health established the Under 5 Clinic program to address this problem. So, ano ang program and objectives and goals? So, monitor the growth and development of child under or until 5 years of age. Identify the factors that may hinder the growth and development of the child. So, ano-ano yung mga activities and strategies? Regular height and weight determination, monitoring until 5 years of age, from 0 to 1 year old, monthly. Okay? 1 year old and above, quarterly. So, ito yung reason kung bakit dun sa mga health center, parati itong nino-note down ng ating mga barangay health worker at the same time ng school kasi ito ay magiging part ng kanilang KPI, okay? O ng mga dapat nilang i-report na hinihingi din ng programa na ito. Yeah. Pero sa amin sa lugar sa Calamba, wala akong masyadong napapansin ganito. But in Manila, madalas nakikita ko sila na nagaganito. Yeah. Recording of immunization, vitamins, supplementation, deworming, and feeding. Ito, very active ito para sa mga eskwelahan na my exposure is from Laguna and also in Manila. So, lagi ko itong nakikita. I'm not sure in your different towns and barangays, but in Manila at saka sa Calamba o sa Laguna, laging merong ganitong mga activities. Provisions of IEC materials, examples of posters, charts, toys that promote and enhance child's proper growth and development. Provisions of safe and learning-oriented environment for the child. And after all of these has been done, you need to monitor and evaluate if effective. Yan. So, I guess, sa strategy ng Department of Health, maraming nakikinabang dito sa ganitong programa. And importante, natutulong talaga tayo bilang mga mamamayan or mismong public health nurse dahil lalong-lalo na yung deworming and feeding. Ayan. And vitamin supplementation at yung pagre-record natin ng immunization. Importante na ma-impose dahil ito ay mga libreng serbisyo na binibigay ng Department of Health. So next is the breastfeeding and lactation. So isa sa mga programa ng gobyerno na parati nating naririnig at nagiging part na ito ng mga commercials. And also, kung mapapansin ninyo, if you go to SM, dati hindi sila binibigyan ng importansya yung mga nanay na nagpapadede, kaya minsan magugulat ka na lang may naglalabas ng dede sa mga sulok or habang sila ay nakumakain sa isang food court, walang lugar. But because of the changes and at the same time sa panahon, meron nang nilalagay ang mga mall and they are required na meron na silang specific area kung saan doon pwedeng magpadede si nanay. Okay? Para magkaroon ng privacy. And that is because of this program. Breastfeeding, lactation management, education, and training. So breastfeeding practices has been proved to be the very beneficial to both the mother and baby. Thus, the creations of the following laws support the full implementations of this program. So that's your Executive Order number 51, Republic Act 7600, or the Rooming In and Breastfeeding Act of 1992. Okay? So kapag merong kinalaman sa breastfeeding, Executive Order number 51, Republic Act 7600, or also known as the Rooming In and Breastfeeding Act of 1992. Let's try to digest and go deeper. Okay, so ano-ano yung mga laws na yon? Executive Order number 51. Ano yung aim? Provision of safe and adequate nutrition for infants. Ano yung approach? Protection and promotion of breastfeeding. And ensuring proper use of breast milk substitute and supplements. Next is RA 7600. It requires both public and private to promote rooming in. It encourages the support the practice of breastfeeding. So yung napansin natin na sinabi ko sa inyo kaninang intro, because of this law, nire-require na both the public and private. Not only just in the hospital area, but also in the mall. Diba? So may nagbabago. Mabagal lang. And RA 8976 or Food Fortification Law. This is an act establishing the Philippine Food Fortification Program and for other purposes. So lahat ng mga gatas na ipinuproduce ay meron ng Food Fortification Law. So meaning kailangan ilagay nila doon or i-divulge nila lahat ng mga info na kailangang malaman para mas makapili yung mga tao or consumer ng mga nutrisyon na sa tingin nila ay mas appropriate bukod sa kanila pati sa mga bata. Okay? Same thing doon sa mga gatas. Okay? So program objectives and goals, protection and promotion of breastfeeding and lactation management education training. So okay, so full implementations of laws supporting the program. Okay. So RA 7600, the rooming in. And isa sa mga provision nito is yung Human Milk Bank. And magkakaroon ng sanction and regulation kapag hindi sumunod. So, second, conduct orientation advocacy meetings to hospital and community. So, kailangan nilang obviously i-emphasize itong mga advantages na to habang sila ay nagpapadede. Okay? Mother, Yung oxytocin, nag-help yan para sa uterus ay mag-contract at bumalik sa kanyang normal level. Nagkakaroon ng uterine involution, obviously. Reduce incidence of breast cancer. Promote maternal-infant bonding. And form a family planning method or yung tinatawag nating lactation amenorrhea. Later on, magkakaroon tayo ng video presentation pagdating doon sa lactation amenorrhea. And yung programa ng Department of Health as well. So, ano ba ang action ng oxytocin? So, number 1, contraction of smooth muscles kagaya ng uterus at it will enhance the labor. Contraction din ng mammary gland or myoepithelial cells or the ovuli and the ducts para naman sa ejection ng milk. Kaya makakatulong yan. Sa kalalakihan naman, ejaculation, contractions of vas deferens propelling the sperms toward the urethra. Okay? And remember, oxytocin is concerned with releasing or ejection of milk, while prolactin is concerned with synthesis and production of milk. So kapag ang oxytocin ay concerned sa pag-release or ejection ng milk. Okay, next. So, si baby. So, kapag nagpapadede ang nanay, so, provides antibodies. So, contains lactoferrin. Ito yung nagbabind sa iron. Leukocytes. And it contains a bifidus factor promotes growth of the lactobacillus, inhibits the growth of the pathogenic bacilli. Okay, so yan yung nagiging benefit. Okay, another benefits for infants, provide a nutritional complete food for the young infant. So, it's a complete meal, obviously, kung infant yung pinag-uusapan natin. It strengthens the infant immune system by preventing many infections, safely rehydrates and provides essential nutrients to a sick child, especially to those suffering from diarrheal diseases, and reduces the infant's exposure to infection. And for the mother, reduces a woman's risk of excessive blood loss after birth, provides a natural method of delaying pregnancies, reduces the risk of ovarian and breast cancers and osteoporosis for the family and the community, conserves funds that otherwise would be spent on breast milk substitutes, supplies, and fuel to prepare them. Save medical costs to families and government by preventing illnesses and by providing immediate postpartum contraception. Yeah, so obviously these are all self-explanatory. Okay, positions of breastfeeding the baby. Okay, I'll give you the hint. And bukod dito sa mga na-identify natin, you will watch a video concerning or pertaining to this type. So let's watch the video.
We talk about latch as a general term. It means that the baby is sucking well from the breast and is properly positioned. In the hospital, we also use latch, LATCH, as an acronym that helps us to assess how well the baby is nursing. For example, we're looking for a good latch for swallowing, tender breasts, nipple condition, and how much assistance the mother needs during the nursing session. Your nurses will watch you nurse and make this assessment at least twice a day to ensure that things are going well. If not, they'll help you make adjustments as needed. The latch is so important because it affects your baby's ability to get the nourishment he or she needs, to effectively empty the breast, and to do so without causing damage to your breast tissue. Your baby will be most responsive to eating when hungry but not starving. So watch for signs that your baby's ready to eat. These are called feeding cues, and you might notice that your baby's licking his lips, squirming a little bit more than usual, or trying to eat his hands when he's ready to eat. These signs come before getting angry to the point of crying. It's easier to latch your baby on when they're not crying because it actually affects their tongue position. When latching your baby, begin with positioning your hand in either a C or a U shape and support your breast in that position. Make sure that the fingers on the underside of your breast aren't touching the areola or dark skin around the nipple. Position your baby's head so that her nose is in line with the nipple. Think about how we drink or sniff. We tip our heads back, and this is what you want to do with your baby when you bring her to the breast. Tickle her upper lip with your nipple to get her to open her mouth, and as soon as she does, connect your baby's mouth with your breast tissue, chin first, being sure to get as much of the areola in your baby's mouth as possible. Your baby's upper lip should be aimed for the nipple, and his bottom lip should be aimed as far away from the base of the nipple as possible. This is an asymmetrical latch. You should see your areola above the baby's upper lip, and if so, your baby's tongue will be drawing in more of the breast tissue from below. The head should be slightly tilted back and the nostrils free from obstruction. Look for and listen for swallowing. Some babies are noisy and it's obvious. You can hear them gasp and swallow, but others you just have to watch their throat to see if they're swallowing. Also watch for deep jaw movements that indicate that they're latched well. A baby that's not latched well will look like they're doing a fish face versus a forward jaw movement. Examine your nipples when your baby is done nursing. If they look asymmetrical like a new tube of lipstick, your baby is not latched properly. And if you continue to nurse that way, it could cause complications for you. Know that it's normal to feel intense burning or stinging for the first 30 to 60 seconds of a nursing session for the first 2 weeks of your baby's life. But if you continue to feel pain past that point, your baby might be latched improperly. When breaking the seal of your baby's latch, never pull the baby off the breast. Instead, gently slide a clean finger into your baby's mouth and disconnect the seal, then remove the baby from the breast.
So, breastfeeding, tandaan natin para dun sa mga bata, breast milk is best for babies up to 2 years old. Exclusive breastfeeding is recommended for the first 6 months of life. At about 6 months, give carefully selected nutritious foods as supplements. And breastfeeding provides physical, psychological benefits for children and mothers as well as economic benefits for families and societies. So, napapansin naman natin yan, di ba? Na kapag yung bata ay napadede ng more than 6 months, ay mas nagiging matatag psychologically and at the same time, nagiging maayos yung kanyang immunity. Yan. So, isa yan sa mga benefits na nai-enjoy kapag ka napapadede. But syempre, because of the advent of time and technology, minsan hindi na rin naiisip. Kaya in less than 3 months or 6 months, saka lang natin ibinibigay. So the next is Garantisadong Pambata or GP. Garantisadong Pambata is a biannual week-long delivery of a package of health services para sa mga bata, children between the ages of 0 to 59 months old, with the purpose of reducing morbidity and mortality among under 5 years old through the promotion of positive Filipino values for proper child growth and development. So what are the health services offered in GP and who are the targets? Okay. So, GP offers the following: routine health services. So, nagbibigay sila ng vitamin A capsule. Ano ang dosage? 200,000 international unit or 1 capsule or 100,000 or 1/2 cup or 3 drops. So, orally by drops, yan yung ating route of administration. Ano ang target population natin? From 12 months to 59 months old nationwide. So, 9 to 12 months old infants receiving AMV nationwide. So, ferrous sulfate, bibigay din tayo 25 milligram or yung tinatawag nating elemental iron, 30 ml. Bottle as taken home as a medicine for instruction. So, importante yan. I-explain natin mabuti kay nanay. So, 0.3 ml kapag ka 2 to 6 months old, once a day. Kung ang pasyente naman ay 6 months to 11 months old, 0.6 ml once a day. Orally then, by drops. So, 2 to 11 months old infants in Mindanao area, including evacuation centers and armed conflict areas. So, ganoon ka-comprehensive yung nabibigyan ng vitamins, including yung Mindanao. Yan. So, I guess, ngayon, mas mari-reach out yung area sa Mindanao because of the new law, Bangsamoro. Yan. Pero hindi ako sure kung ito ay implemented na right now. So, routine immunization, nagbibigay din tayo ng BCG, DPT, OPV, AMV, and hepatitis B if available. Yan. So, it's up to you to memorize all of these and at the same time kung ano yung route, ano yung dosage, at kailan ito ibinibigay. Yan. Pakilista nyo na lang po. Just post the video and try to write it down for maximum retention. Next is the warming drug. Yan. So, kung available, isang tableta as a single dose. Yan. Oral, 36 to 59 months nationwide. Okay? So, usually, nagbibigay ng consent itong si nanay, binibigay sa eskwelahan, tapos ipinapadala kay nanay, at kailangan nilang pirmahan. Okay? And ito ay subok na at wala na tayong nakikitang reports na nagiging violent or nagkakaroon ng adverse reaction pagdating sa deworming. Dahil lahat naman ito ay importante dahil nga yung source of water natin ay hindi pa lahat na galing sa nawasa. So meron pa rin tayo na deep well, kumbaga. That's why deworming is an effective program ng Department of Health para masiguro natin na lumalaki yung mga kabataan natin under this 5 clinic na tinatawag ng Department of Health ay masigurado na yung mga nutrients ay naibibigay or na didistribute ng maayos sa katawan ng mga bata. Yan. So, pagtanggal nitong mga bulate na to. So, weighing, lahat ng pasyente, obviously, napapasok dito. The child should not have received megadose of vitamin A above the recommended dosage within the past 4 weeks, except if the child has measles or signs and symptoms of vitamin A deficiency. For any child between 12 to 23 months who missed any of his routine immunization, the health worker should give the child the necessary antigen to complete the FIC and shall be recorded as such. So, garantisadong pambata or yung sangkap Pinoy. So, yan yung ating ibinibigay. Vitamin A, iron, and iodine. Ano yung mga sources na pwede nating sabihin kay nanay or kay tatay or sa community ay green leafy and yellow vegetables, fruits, liver, seafoods, iodized salt, pandevida, and other fortified foods. So these micronutrients are not produced by the body and must be taken in the food we eat, essential in the process of growth and development. Okay, so helps the body to regulate itself. necessary in energy metabolism, vital in brain cell formation and mental development, necessary in the body immune system to protect the body from severe infection, and eating sangkap Pinoy rich food can prevent and control protein energy malnutrition, vitamin A deficiency, iron deficiency anemia, and iodine deficiency disorder. Kung matatandaan ninyo before, yung sangkap Pinoy seal na inilalagay, panahon pa to ni Secretary Flavier or Senator Flavier, isa yan sa mga nasimulan niya na nagkakaroon sila ng mga sangkap Pinoy seal. And ito yung ginagamit nila na parang way para yung mga consumer, lalo na yung mga kabataan na may deficiency sa ganitong klaseng vitamins or sa protina or sa iron and also sa iodine, na itong product na ito ay na-fortify at dapat bilhin kasi na bigyan to ng identification at natag na sumusunod sila doon sa specific numbers.